Hello everyone out there. I wanted to go over a couple of quick things with you. I was working with a patient yesterday and the patient came in and he had an accident, an auto injury a while back, and was coming in because he was having pain and wanted to see what we could do for him. And so one of the things I noticed whenever he was coming in, he had a lot of questions, but he didn't know the different things you want to make sure of when you're going through this process. So usually what happens is a patient will have an injury and then they'll go to the ER and then they'll follow up with their PCP and then they'll do PT somewhere, and then maybe they'll see a chiropractor somewhere, and then they're sent for pain management. And so they go through this process. And so one of the things we notice is when you're going through this process and you're basically seeing different providers, if nobody's keeping that consistency within the providers, what happens is that the diagnoses start to look inconsistent. And that really hurts your case. And so what we want to do is make sure that whenever a patient comes in, we want to make sure that everything is basically documented and everything is consistent. And that's why we have this office set up the way it is. That's why we have medical providers. That's why we have chiropractic. That's why we have all the different nurse practitioners and things like that that we have, because we want to make sure that we're able to offer the different services that the patient needs, but it's all done consistently and we collaborate and make sure that the patient in the end is better. And then also, whenever the patient's done, they get the settlement they deserve because they've gotten the treatment they needed and it's documented correctly. Hopefully that helps.